Diabetes has traditionally been considered a progressive, incurable condition, wherein the best case scenario after diagnosis is tight blood sugar control in the hopes of decreasing the risk of secondary complications. Even individuals who have a strong history in their family of diabetes, they believe that it is inevitable that they are going to become diabetic also at some time. The medical community has agreed with this conclusion throughout my medical career. In the mid-1990s, I spent 3 years researching the medical literature in regards to how my patients, first of all, could avoid or prevent becoming diabetic, since it's been well established that diabetes is primarily the result of poor lifestyles. Perhaps healthy lifestyles could prevent one from becoming diabetic, even if they did have a strong family history of diabetes. This led to the writing of my book, Healthy for Life, in 2005. Since that time, my online Healthy for Life program has been involved in over 3 separate clinical trials that prove the fact that individuals who had pre-diabetes could reverse their disease by firmly establishing healthy lifestyles that improved insulin sensitivity. This was really just a triad of healthy lifestyles that consisted of a healthy diet that combined those good low glycemic carbohydrates, good proteins, good fats, along with a modest, consistent exercise program and nutritional supplementation. In 2009, the American College and Association of Endocrinologists met and developed a consensus opinion regarding prediabetes. They concluded that we need to be treating prediabetes as aggressively as we treat diabetes, because by the time an individual becomes diabetic, their cardiovascular disease is too advanced to really help them. They looked at the worldwide medical literature, much like I did, and agreed that the best way to treat prediabetes was through intensive lifestyle changes. Now, in December 19, 2012 issue of the Journal of the American Medical Association, a study was reported that showed an association of intensive lifestyle intervention and the potential to actually reverse type 2 diabetes, and this study was called the Look Ahead study. This is the first time in my medical career that I had seen a study that actually demonstrated that you can reverse type 2 diabetes. The study looked at over 4,500 adult diabetic patients and followed them for over a 4-year period of time. They placed these individuals on an intensive lifestyle program that primarily was made up of a healthy diet and just modest exercise. The difference was the fact that they strongly supported these individuals by regular counseling and guidance. The participants were assigned to either this aggressive lifestyle change approach or to the more traditional diabetes support and educational intervention. As many as 11.5% of the participants in the intensive lifestyle change group had partial or complete remission of their diabetes. In those individuals who either were earlier in their disease or not using insulin, there was over a 20% partial or complete remission. Over the past 18 years, I have had hundreds of patients who had already been diagnosed with diabetes use my online program to better control their diabetes. I have learned that it takes my diabetic patients somewhere between 18 and 24 months to receive optimal improvement from these intensive lifestyle changes. All of my diabetic patients saw improvement in the control of their diabetes. Many were able to actually control their diabetes without the use of medication. However, I have documented in my small practice over 50 diabetic patients that had complete reversal of their diabetes and have remained non-diabetic as long as they continued the lifestyle changes they learned in the program. The reason I feel that I have had so much better success than reported in this particular clinical trial is because I strongly recommended not just a healthy diet, but a low glycemic diet that did not spike their blood sugar, exercise, and nutritional supplementation. Each one of these lifestyles actually improves insulin sensitivity by a different mechanism. These researchers did not promote a low glycemic diet, nor did they recommend nutritional supplementation. Presently, I'm also recommending homeopathic drops to my diabetic patients, which I personally believe improves insulin sensitivity and helps my patients lose excessive weight much faster. I feel that I'm accelerating this entire process so that my diabetic patients can optimize the health benefits from these intensive lifestyle changes much faster than I've ever observed before.